Hello everyone, welcome to Heartypedia channel. Do you know there is a single disease that can lead to life-threatening conditions like heart attack, lung diseases, blood pressure, clotting disorder, and even cancer? So what are blood clots? What is the reason for them? And how can they be life-threatening? In this video, we are going to talk about the 5 blood clot symptoms you should not ignore. But first, let's find out about the science behind blood clots. So stay attentive and watch the video until the very end, making sure you do not miss any essential detail. Make sure to subscribe to the channel so we can share with you the top health tips regularly. Blood clots are beneficial as long as they occur on an injury. It has been helping humans for thousands of years to survive and recover from injuries. When an injury happens on our body, the blood gathers on the injury and makes a jelly-like substance, which later gets hardened and becomes a clot, not allowing the outside virus or bacteria to enter the skin. It doesn't become an issue until the clots start taking place inside our body rather than outside it. There are so many causes out there that can lead to this abnormal behavior of blood clots, but whatever it is, the clots start taking place in our blood vessels and start blocking our vessels. The blood does not get enough room to normally flow because of these clots. This disturbance in the system will eventually lead to numerous diseases. We need to prevent something like this from happening to us. So, what do we need to do? Some symptoms appear when blood clots start appearing. We need to take those symptoms seriously and prevent them from growing. Let's talk about those 5 symptoms that can save us from this miserable condition. Let's get started. Number 1. Swelling in your leg. Swelling of legs can be caused by many reasons. It could be because of diabetes, if you have one or many others. But if it is happening in one leg initially, happens all of a sudden, and appears with the other symptoms of blood clotting, then you should get serious about it because it can be very dangerous for you. One of the few types of blood clotting that happens in our veins normally in one leg is known as DVT, deep vein thrombosis. The blood clots stop the blood from flowing into the legs and go back to the heart. When the blood does not find the way to move on, all the fluid blood was carrying starts releasing in the leg. This will make your leg look bigger and puffier than the other leg. This symptom is visible enough to get cautious. What could be the causes for blood clotting in the veins known as DVT? Many reasons could be the culprit behind it, but age is a natural one. As you grow old, your body gets weak, and conditions like this can start happening. This one may be surprising, but sitting in one place for hours without much motion can also lead to puffing in the leg. Many other factors like smoking, pregnancy, injury, or even birth control pills can cause blood clotting in your legs. Contact your doctor immediately if you develop the signs of DVT. In some cases, like the more dangerous type of blood clotting that happen in the pulmonary artery, seek emergency medical care as soon as possible. Number 2. Pain in your legs or arms. If you feel pain in one of your arms or leg, you should at least give it some attention, because even though it can be just a normal muscle pull or cramp, but chances are that it's not. Pain in one arm or leg often happens with other symptoms, but sometimes only pain can be the only symptom that appears. So if you feel pain or pressure in your one arm or leg, it could be because of the inflammation. As we already discussed that blood clotting in the legs or arms can lead to condition DVT. The blood does not get to travel and your legs start to swell. The leg pain or arm pain are not something different. DVT is the reason behind this pain as well. The soreness or puffiness can go undetected or neglected sometimes, but the pain is not. So pain in your legs or arms is an alarm that your internal system is not very functional. A person usually feels an intense attack of pain when he flexes his legs or arms upward and moves it a little bit. This is also the cause of DVT. Number 3. Redness of the skin. Redness on the skin can be a normal ache or bruise, but you need to start taking it seriously when you feel it on different parts of your body, and this redness is warm when you touch it. The blood clots in your body do not allow the blood to flow into the veins. This condition is DVT, as we discussed. But this condition is not bound to your one arm or leg only. It can take place at any part of the body. The stop of blood leads to pressure in the veins causing inflammation and the release of fluids at the spot. The pressure at one spot and the excess releases of energy at the spot can cause redness, and that spot can get hot. Not only the redness, but your skin can look discolored at some spots due to the damage done by the blood clots. But just know that in some rare cases, redness can appear without any swelling or pain. You can avoid wearing tight clothes, as it can make it worse for your blood. Wear loose clothing and do some exercises your doctor tells you to keep the blood flowing and avoiding the blood clots from getting any bigger. You can also wear compression stockings to tackle this situation. When the redness along with the warmth appears on your skin, go to your doctor and have him take a look. Follow whatever prescriptions he gives you and avoid this condition becoming a serious problem. Number 4. Chest pain. If you suffer from chest pain along with other symptoms, this is an alarming situation and you need immediate medical attention. Unlike the other symptoms, this one can threaten your life. So here is everything you need to know about it. But the real issue starts when these clots along with blood travel to our vital organs like the brain, the heart, or the lungs. The one we are about to discuss is about the lungs. When the clots enter our lungs, it causes the condition known as pulmonary embolism. This is the most dangerous type of blood clot. When clots stop the blood path in the lungs, it can cause severe pain in the chest. The pain can be so severe, it can often be mistaken for a heart attack. By the way, clotting so near the heart also maximizes the risk of a heart attack. How can you distinguish between the two? The heart attack signs begin with the rattling in the upper parts of your body, such as shoulders and jaw. Pulmonary embolism can show up with other symptoms we discussed. Another major indicator is your breathing. If your breathing worsens with pain in the chest, then the cause is blood clotting, not heart attack. 25% of people die of this disease without even detecting the real problem. So if a chest pain sign appears to you, you could be in an emergency situation and you need to act like it. Call 911 immediately or just go straight to your doctor if you could, and let him handle the situation and the pain with proper treatment to get rid of this problem as soon as possible. Number 5. Increased heartbeat. Increased heartbeat is normal after exercise or if you got scared or some other natural reasons, but it can also be an indication of dangerous blood clots. How? Let's learn. This symptom is associated with a severe type of blood clotting known as pulmonary embolism. When you know about the possibilities of having a pulmonary embolism, there are also the chances that some of the clots are lurking close to your heart. When the clots come in the vessels going directly to the heart, the blood will not pass easily due to the blockage caused by the clots. In other words, not enough oxygen will reach your heart. Lack of oxygen can cause your heart to beat at a faster pace. The bigger the clot is, the more the shortage of oxygen it will cause in the heart. Another reason for the increased heartbeat is due to clotting in lungs. When the blood clots station themselves in your lungs in a defensive response, your lungs release a combination of chemicals. These chemicals also make your heartbeat increase a lot. You can also experience some other symptoms with an increased heartbeat, like unexplained cough, shortness of breath, faint feeling, and these are also linked with a severe type of blood clotting known as pulmonary embolism. The prevention of pulmonary embolism is pretty much the same as the DVT, which is a less severe type of blood clotting, as one leads to the other, so avoiding the main causes of the first will prevent us from the other one as well. So stop smoking, exercise regularly, keep your arms or legs moving, and do not keep them stationary for hours. Additionally, drink lots and lots of fluids such as water, juices, or shakes, and you can prevent this condition from even lurking near you. Subscribe and turn on notifications so you do not miss more videos of health tips and much more. Check out this playlist of Heartypedia channel. Let's end with this, guys. We hope this video was informative to you.